Hello everyone, I interviewed Dr. Roger. He's our best microbiology professor in the university. My first question, what is coronavirus?
Well, coronavirus it's a family of viruses that includes the virus that causes the common cold and the severe respiratory, the SARS type group of viral diseases.
People say the reason of coronavirus outbreak in China caused by Chinese people eat bats. There are some Chinese who eat wild animals, but when people cook, high temperature can kill everything. Is coronavirus really related to eat wild animals?
Well, so coronaviruses are a group of viruses that live in animals and then are transferred to humans. Okay. So they're called zoonotic viruses.
Zoonotic.
Yeah, zoo referring to animals. Okay. And so yes, most coronaviruses will have an animal reservoir, a group of animals that they spread the virus around in.
Okay.
And then when humans come in contact with those animals, some of those viruses can now jump to humans. So eating is not the only thing. It could be relating to food gathering. If a human happened to hunt a wild animal that was infected, doesn't have to be eating it. Maybe he just touched it, but then later touched his face, he now has the virus. If they happened to collect a pangolin from the environment and it had the infection, they handled it, maybe it's still alive, they didn't eat it, but if they touched their nose, their mouth, or their eyes, now the human has the virus. Or it could have been even more simple than that. If they have a family pet, a cat or a dog, that happens to eat an infected animal, now you touch your cat and you could get the disease. So there are lots of ways where the virus could be transferred from a wild animal to a human. But you're right, cooking would kill the virus. So the fact that people got the virus from these animals indicates that somehow they handled an animal and then received the virus from that.
There are people eat wild animals in all over the world. Why coronavirus outbreak in China? Population density or other factors?
Well, it's a combination of bad luck, probably population density. Bats probably have their own diseases. It's just a different, because they're in isolation, the bats across the world don't necessarily share all diseases. So my guess is the coronavirus developed in that area of China and then happened through bad luck, happened to transfer to a person. Handling of wild animals, you have to assume they have some sort of diseases, but not all viruses can make the leap from a bat to a human. So there was something special about this coronavirus that yes, it was working in this bat population or the pangolin population, but it also had the ability to bind to human cells as well. And so it was just that particular strain of virus had the ability to jump to humans, and a person happened to come in contact with that animal, and then that person happened to share it with their closest friends. Because of high population densities, it started to spread very rapidly from person to person. So really, I think it really did just come down to bad luck. The same thing could happen anywhere in the world, but if you had very few people, maybe the sick person just never comes in contact with anybody else and it stops. Or if it's another virus that just isn't maybe it's still a coronavirus, but it's not as infective, maybe they spread it to a person or few, but after a while it just sort of disappears.
How coronavirus transmitted from person to person?
They can be spread from person to person by direct touch. Like if I sneeze and then touch you, you could get it. If I touch the desk and then because I've been sneezing, again, coronaviruses just typically cause respiratory problems. So a runny nose, watery eyes, sneezing, coughing. So if I cough or sneeze into my hand and then touch a desk, and later you come and touch the same place and then touch your mouth or your nose, you could pick it up that way as well.
How long the coronavirus can survive itself?
Probably several hours. It depends on the condition. Like if sunlight is shining on it, probably less. But in an environment like this, probably several hours. Which means if one student has it and sits in the desk at 8 o'clock in the morning, people could probably still be infecting themselves from that desk several classes later. Kind of scary, isn't it?
Yeah.
Really, it's kind of In that respect, it's really no different than the flu or the common cold.
Yeah, but coronavirus is a new virus, so people don't know about it.
Exactly.
So that's the biggest reason why panic people.
Exactly right. People tend to fear what they don't understand.
China is expected to end the coronavirus and return to normal life at the end of April. A Japanese media forecast the coronavirus will not disappear before end of August. Which one you more believe?
Well, it's hard to say. Because it's just starting to spread among humans, we don't know a lot about it. But colds, for example, which is part of the same family of viruses, they tend to be passed around more often during the winter months. When it's cold, our immune system is depressed a little bit, the air is dry, so our nasal passages are dry, and it's harder for us to get rid of the virus. And so in winter months, we do tend to spread them around a lot more. Plus, in winter months when it's cold, people tend to stay inside in closed rooms, sharing each other's breath and so forth. However, we don't know very much about how this particular virus is transmitted. I suspect that we'll start to see numbers drop in the spring as people are spending more time outside and there's more moisture in the air. But I don't think we'll ever, I think this virus is here to stay. I think it's going to be around all the time from now on. We'll never be able to eradicate it from humans. Kind of like the cold or the flu.
How long does it take to develop a coronavirus vaccine?
So there are several stages involved in creating a vaccine. One is discovering a molecule that can cause our immune system to start making antibodies and a type of cell called a TC cell that helps to fight viruses. I mean, we have to find the right type of chemical to inject to teach our body to start fighting it. But then there's also a period of testing. Somebody says that using the molecular structure, the genetic structure of the virus, they were able to come up with a vaccine, but it hasn't been tested yet. They found something that works in a computer, but I doubt they've actually proven that it will create an effective immune response. So there will have to be a period of clinical trials to make sure it's effective and safe. And that's probably going to take a year or more to do that. But even at that, they then have to amplify it to get enough doses to treat all of China or everybody who's likely to be affected. And that's going to take another year. I'm guessing you're probably not going to see a vaccine for about 2 years, maybe longer, because we don't have an effective vaccine against the common cold yet. And this is part of that same family.
Although there are no specific drug to cure coronavirus yet, but many people have fully recovered. Will people be infected by coronavirus again after they fully recovered?
In general, no. Once we have immunity, our immune system is very good at protecting us because of the TC cells and the antibodies. They should be able to protect us. The problem with viruses is they do tend to change. They mutate. And so that's why we have to have the flu vaccine every year, is because the flu is it's a different strain every year. And so we have to receive the vaccine for the current strain of the flu virus that's coming along. It may be the same with the coronavirus. Right now, probably everybody is sharing the same strain, but the longer it's spread between humans, the more it's going to change. And after a while, it could come back as sort of a different form of the virus that our immune system may not recognize. So my guess is I think coronavirus is here to stay, and I think it will change periodically. And every year we may need to take our flu vaccine and our coronavirus vaccine to keep us protected. But in general, it should protect us from that strain for a long period of time.
I use this equation to calculate the mortality rate. And the rate kept decreasing by time. And why coronavirus confirmed cases jump thousand a day since February 10th, under control or out of control?
The reason is scientists, doctors have learned how to detect the infection earlier. And so in the beginning, it was just those people that were really, really sick who we knew to be infected. And we knew that of these people that were showing these bad symptoms, about 2%, 2 to 3% died. But now, Chinese researchers have figured out how to detect the illness much earlier. And so even though they're not showing symptoms yet, we know they're infected. Okay, let's say this is everybody who's infected, everybody who's been exposed to the virus and now has it growing in their body. Originally, we only knew about maybe this many. These people were the ones that were having trouble breathing. They were obviously sick from the virus. Okay, and we knew that for every 100 of these, 100 infected, 2 would die. So that's about a 2% mortality rate. Okay? But now we can detect all of these people. These people are also infected, but we can detect it earlier. Maybe they're not showing symptoms. They don't have a fever yet. They don't have trouble breathing yet. They don't even know they're infected yet. But using various tests, immunology tests or chemical tests, we're able to detect them. And so we know we're still seeing out of this number, maybe only 2 are dying per every 100. And so the overall rate appears to have been lowered. Okay? But it's simply because we're better at detecting the number who are infected. And so even though these people that are showing these severe symptoms, about 2 out of every 100 are dying, we're now seeing that there are lots of people who are not getting that sick. I think most of the people are going to be fine. So we're seeing this, we're going to see this number start to drop as we're able to detect earlier the number of people who are actually infected.
Coronavirus, MERS, SARS, Ebola, influenza, and other well-known viruses. Can you rank those viruses from the most fearful one to the least?
Not really, not off the top of my head. But the fear factor kind of has 2 parameters. One is how quickly it spreads, and the other is how many people it kills. The coronavirus appears to spread very quickly, but its mortality rate is probably only 2% or lower. Influenza spreads very quickly, but I think it has a much higher mortality rate. Measles doesn't spread very fast, but I think it has a higher mortality rate. Coronavirus is kind of scary right now, for one, because it's in the news and we're hearing about it every day, but also because it spreads very quickly. We're seeing the numbers jump by thousands every day of people who are infected, but I don't think the mortality rate is anywhere near what measles or the influenza viruses are. So we're scared of coronavirus right now, mainly because we're hearing about it and we don't really know much about it. But actually more people are dying from influenza every year than they are from coronavirus.
Over 10,000 Americans killed by flu in this season. Are those fake news? I understand people die every second, but over 10,000 people is much larger number than people who have been killed by coronavirus in China. But over 10,000 people died in this season. Is this the average number each year, or this is unusual?
Probably about right, probably normal. Remember, flu is spread around quite rapidly. A lot of people get it every year, and sometimes several times a year. Generally, most people who get the flu recover, and that's why we don't get scared about it. But people who are elderly or very young or who are already sick and their immune system isn't working, they are more likely to die from it. But because it's so familiar, sometimes we don't fear it as much, unfortunately, and we don't take appropriate precautions. And so if more people would, especially the elderly and the young, and people who are already sick, if they would get the vaccines and take precautions like washing their hands and things like that, I think we'll see those numbers start to drop. But for some reason in America, there's a bunch of uneducated people who refuse to vaccinate themselves or their children. Right now, it's just misinformation on the internet. And there's a fear for vaccines, which is crazy. because vaccines have been protecting us for about 200 years now. It's just people who are not educated about vaccines, who get their news and their medical advice from Facebook rather than from medical professionals.
Should people worry about the flu in America?
Absolutely. Everybody should get the flu vaccine, especially if you're at risk. So elderly, working with children, or already sick.
Okay.
Yeah.
So people already sick, they also can get the vaccine.
Well, I guess what I mean by that is if you have cancer, for example, your immune system is not working very well. So sometimes if you have other diseases, just being elderly, your immune system isn't working as well. So your immune system is compromised. You should definitely get a flu shot every year. If you're working around lots of students or young kids, absolutely. You can assume that you're going to be exposed to the flu and you should get the vaccine. But people, because it's familiar and they say, oh, I've had the flu every year since I was 10 and I've always recovered, they don't think it's as serious as it actually is. And so they forget to get the flu vaccine, or they don't feel like getting the flu vaccine, or maybe because they don't understand how it works, they think they'll get the flu from the flu vaccine. Uneducated people have some strange ideas.
There are no specific drug to cure coronavirus yet. How hospitals treat coronavirus patients?
Even if there's nothing we can do to eliminate the virus, the hospital can give you intravenous fluids, for example. They can support you until your body has a chance to develop its own natural immunity. So they can give you drugs to lower the fever. They can try to manage the symptoms. If you're at home, there's the risk that you're going to suffer from the pneumonia that results, and you're more likely to pass away, I think. So I think it's important to get medical care if you think you're infected. Again, modern medicine, they may not be able to cure the virus at this point, but they can give you the medicine to prevent death in a lot of cases. Again, they can't eliminate the virus. We don't have any antivirals that are known to work right now, but they can treat the pneumonia, helping to drain fluids from the lungs. They can give you fluids if that's what's needed. They can help keep you alive until your body has the chance to develop its own immunity. So I strongly recommend that if somebody thinks they have the symptoms of this, that they contact a doctor, a physician, and make sure they have that medical support.